What is the primary use of a sphygmomanometer? Your options are measuring heart rate, measuring blood pressure, measuring oxygen levels, or measuring blood sugar. The correct answer is B, that is measuring blood pressure. A sphygmomanometer is a device used to measure blood pressure, consisting of a cuff, bulb and manometer. Question number 2. Which instrument is used to measure oxygen saturation in the blood? Your options are stethoscope, glucometer, pulse oximeter, or thermometer. The correct answer is C, that is pulse oximeter. A pulse oximeter is a non-invasive device used to monitor oxygen saturation and pulse rate. Question number 3. What is the laryngoscope primarily used for? Your options are viewing the lungs, examining the throat, intubation, or removing tonsils. The correct answer is C, that is intubation. A laryngoscope is used to visualize the vocal cords during intubation for airway management. Question number 4. Which tool is used to sterilize surgical instruments? Your options are incubator, autoclave, centrifuge, or nebulizer. The correct answer is B, that is autoclave. An autoclave uses high pressure steam to sterilize medical instruments and eliminate pathogens. Question number 5. What is a Foley catheter used for? Administering medications, urine drainage, wound irrigation, or oxygen delivery. The correct answer is B, that is urine drainage. A Foley catheter is a sterile tube inserted into the bladder to drain urine, often used in hospitalized patients. Question number 6. Hello friends, welcome back to Dear Competitive Exam YouTube channel. Today you are attending 100 most repeated and most important question answer session based on nursing instruments. And this is the part 1 of this series. So let's challenge your quality of learning. Let's see what will be your score from this part 1. So do watch this video completely to make yourself more fit to answer any kind of question. And at the end, if you find this video helpful, then please do like, subscribe and share this video to all your friends who are preparing for upcoming any kinds of medical exams. Let's continue. Question number 6. Which instrument is used to measure blood sugar levels? Your options are sphygmomanometer, glucometer, thermometer, or hemocytometer. The correct answer is B, that is glucometer. A glucometer measures blood glucose levels using a small drop of blood, often for diabetes management. Question number 7. What is the primary purpose of an otoscope? Your options are examining the eyes, examining the ears, checking the throat, or measuring temperature. The correct answer is B, that is examining the ears. An otoscope is used to inspect the ear canal and tympanic membrane for signs of infection or abnormalities. Question number 8. Which instrument is used to monitor fetal heart rate? Your options are Doppler ultrasound, cardiotocograph, CTG, electrocardiogram, ECG, or spirometer? The correct answer is A, that is Doppler ultrasound. A Doppler ultrasound detects fetal heartbeats and monitors fetal heart rate during pregnancy. Question number 9. What is the primary use of a hemostat? Your options are holding tissue, controlling bleeding, cutting sutures, or measuring pulse. The correct answer is B, that is controlling bleeding. A hemostat is a clamping instrument used to stop bleeding by compressing blood vessels during surgery. Question number 10. Which device is used to measure body temperature? Your options are glucometer, thermometer, otoscope, or pulse oximeter. The correct answer is B, that is thermometer. A thermometer measures body temperature and is essential for diagnosing fever or hypothermia. Question number 11. What is the purpose of a stethoscope? Your options are viewing the internal organs, measuring blood pressure, listening to body sounds, or administering medications. The correct answer is C, that is listening to body sounds. A stethoscope amplifies sounds from the heart, lungs, and intestines for diagnostic purposes. Question number 12. What is a nebulizer used for? Your options are sterilizing instruments, delivering medication, measuring lung capacity, or draining fluids. The correct answer is B, that is delivering medications. A nebulizer converts liquid medication into a fine mist of inhalation, often used for respiratory conditions. Question number 13. Which instrument measures peak expiratory flow? Your options are spirometer, peak flow meter, ventilator, or respirometer. The correct answer is B, that is peak flow meter. A peak flow meter measures the maximum speed of exhalation, commonly used in asthma management. Question number 14. What is the primary use of a scalpel? Your options are clamping tissues, cutting skin, measuring incisions, or holding instruments. The correct answer is B, that is cutting skin. A scalpel is a small, sharp surgical knife used for making precise incisions during surgery. Question number 15. What is a tourniquet used for? Your options are measuring blood pressure, restricting blood flow, administering medications, or checking reflexes. The correct answer is B, that is restricting blood flow. A tourniquet temporarily restricts blood flow to a limb, often used during blood draws or IV insertion. Question number 16. What does a suction catheter do? Your options are measures oxygen levels, remove secretions, administer medications, or deliver fluids. The correct answer is B, that is remove secretions. A suction catheter clears mucus and secretions from the airway to maintain respiratory function. Question number 17. What is a Kelly clamp used for? Your options are clamping blood vessels, cutting sutures, measuring incisions, or removing foreign bodies. The correct answer is A, that is clamping blood vessels. A Kelly clamp is a surgical instrument used to grasp or compress tissues and blood vessels. Question number 18. What is a vein finder used for? Your options are drawing blood, locating veins, measuring blood pressure, or administering fluids. The correct answer is B, that is locating veins. A vein finder uses infrared light to make veins visible for easier IV access or blood draws. Question number 19. What is an ECG machine used for? Your options are measuring lung function, recording heart activity, monitoring oxygen levels, or checking reflexes. The correct answer is B, that is recording heart activity. An ECG, electrocardiogram, records the electrical activity of the heart, aiding in diagnosing cardiac conditions. Question number 20. What is the pulse oximeter's normal range for oxygen saturation? Your options are 80 to 90%, 90 to 95%, 95 to 100%, or 85 to 90%. The correct answer is C, that is 95 to 100%. Oxygen saturation levels between 95 to 100% are considered normal. Lower values indicate hypoxia. Question number 21. Which instrument is used to examine the eyes? Your options are otoscope, ophthalmoscope, laryngoscope, or stethoscope. The correct answer is B, that is ophthalmoscope. An ophthalmoscope is used to examine the retina and other structure of the eye for abnormalities. Question number 22. What is the main use of syringe? Your options are cleaning wounds, administering medications, measuring blood pressure, or monitoring oxygen levels. The correct answer is B, that is administering medications. A syringe is used to inject medications, draw blood, or deliver fluids directly into the body. Question number 23. Which instrument measures lung capacity? Your options are spirometer, peak flow meter, pulse oximeter, or respirometer. The correct answer is A, that is spirometer. A spirometer measures the amount and speed of air a person can inhale and exhale, aiding in diagnosing respiratory conditions. Question number 24. What is the tuning fork used for nursing? Your options are hearing test, vision test, reflex assessment, or oxygen monitoring. The correct answer is A, that is hearing test. A tuning fork assesses hearing loss by producing vibrations that help determine the type and degree of hearing impairment. Question number 25. What is the main function of resuscitation bag, ambu bag? Your options are delivering oxygen, providing manual ventilation, measuring blood pressure, or cleaning wounds. The correct answer is B, that is providing manual ventilation. An ambu bag is used for manual ventilation during emergencies or when a patient is unable to breathe. Question number 26. Which instrument is used for ear irrigation? Your options are forceps, otoscope, ear syringe, or nasal speculum. The correct answer is C, that is ear syringe. An ear syringe is used to flush out earwax, debris or foreign objects from the ear canal. Question number 27. What is the purpose of a bedpan? Your options are wound care, collecting urine and feces, cleaning instruments, or delivering medications. The correct answer is B, that is collecting urine and feces. A bedpan is used for patients who are bedridden and unable to access a toilet. Question number 28. What does an infusion pump regulate? Your options are heart rate, medication delivery, blood pressure, or oxygen flow. The correct answer is B, that is medication delivery. An infusion pump delivers fluids, medications, or nutrients at a controlled rate into a patient's bloodstream. Question number 29. Which instrument is used to collect sputum samples? Your options are suction catheter, spirometer, culture swab, or sputum cup. The correct answer is D, that is sputum cup. A sputum cup is a sterile container used for collecting samples for respiratory diagnosis. Question number 30. What is the primary use of a scalpel blade holder? Your options are cutting tissue, holding scalpel blades, scraping blood vessel, or measuring incisions. The correct answer is B, that is holding scalpel blade. A scalpel blade holder securely holds the blade during surgical procedures for precise cutting. Question number 31. Which instrument is used to dilate the cervix during labor? Your options are vaginal speculum, cervical dilator, forceps, 𝗂𝐻. The correct answer is B, that is cervical dilator. A cervical dilator widens the cervix to facilitate childbirth or surgical procedures. Question number 32. What is the use of a tongue depressor? Your options are checking reflexes, examining the throat, measuring blood pressure, or cleaning wounds. The correct answer is B, that is examining the throat. A tongue depressor presses the tongue down to allow better visualization of the throat and oral cavity. Question number 33. Which instrument is used to open a vein for IV therapy? Your options are catheter, cannula, trocar, or syringe. The correct answer is B, that is cannula. A cannula is inserted into a vein to establish IV access for administering medication or fluids. Question number 34. What is the nasal cannula used for? Your options are delivering medications, administering oxygen, measuring blood flow, or monitoring heart rate. The correct answer is B, that is administering oxygen. A nasal cannula delivers supplemental oxygen directly to a patient's nostrils. Question number 35. What is a Mayo scissors primarily used for? Your options are cutting tissues, measuring incisions, clamping blood vessels, or holding sutures. The correct answer is A, that is cutting tissues. Mayaux scissors are heavy-duty surgical scissors designed for cutting thick tissue and sutures. Question number 36. Which device is used to warm intravenous fluids? Your options are infusion pump, IV warmer, autoclave, or resuscitation bag. The correct answer is B, that is IV warmer. An IV warmer ensures that intravenous fluids are warmed before administration to prevent hypothermia. Question number 37. What is the function of a curette? Your options are scabbing tissues, clamping blood vessels, cutting skin, or measuring blood pressure. The correct answer is A, that is scabbing tissue. A curette is a small and scoop-shaped instrument used for scabbing or debriding tissues. Question number 38. Which tool is used to examine the nasal cavity? Your options are otoscope, nasal speculum, ophthalmoscope, or laryngoscope. The correct answer is B, that is nasal speculum. A nasal speculum widens the nostril to allow for examination of the nasal cavity. Question number 39. What does a capnograph monitor? Your options are blood pressure, carbon dioxide levels, oxygen saturation, or heart rate. The correct answer is B, that is carbon dioxide levels. A capnograph measures exhaled CO2 levels, that is carbon dioxide levels, which provides insights into a patient's respiratory status. Question number 40. What is a trocar used for? Your options are draining fluids, cutting tissue, administering medications, or measuring blood sugar. The correct answer is A, that is draining fluids. A trocar is a surgical instrument used to create an opening for fluid drainage or inserting instruments. Question number 41. What is a Doppler ultrasound used for? Your options are measuring fetal heart rate, visualizing blood flow, checking oxygen levels, or measuring lung capacity. The correct answer is B, that is visualizing blood flow. A Doppler ultrasound assesses blood flow through vessels to detect blockages or clots. Question number 42. Which instrument is used for gastric lavage? Your options are suction catheter, release tube, Foley catheter, or syringe. The correct answer is B, that is release tube. A release tube is a feeding tube inserted through the nose into the stomach for gastric lavage or feeding. Question number 43. What is the purpose of a dermatome? Your options are cutting thin skin layers, examining the skin, suturing wounds, or cleaning wounds. The correct answer is A, that is cutting thin skin layers. A dermatome is used in a skin grafting to harvest thin slices of skin from a donor site. Question number 44. What is the main function of artery forceps? Your options are holding tissues, clamping blood vessels, cutting sutures, or measuring pulse rate? The correct answer is B, that is clamping blood vessels. Artery forceps are used to clamp blood vessels during surgery to control bleeding and maintain a clear field. Question number 45. What is a laryngoscope used for? Your options are examining the ears, visualizing the larynx, checking nasal passages, or measuring lung capacity. The correct answer is B, that is visualizing the larynx. A laryngoscope is used to examine the vocal cords and larynx or to assist with endotracheal intubation. Question number 46. Which instrument is used for suctioning fluids during surgery? Your options are catheter, suction cannula, Rayleigh's tube, or forceps. The correct answer is B, that is suction cannula. A suction cannula removes fluids like blood or mucus to ensure a clear surgical site during procedures. Question number 47. Which instrument is commonly used for a pap smear test? Your options are curette, vaginal speculum, forceps, or scalpel. The correct answer is B, that is vaginal speculum. A vaginal speculum is inserted into the vagina to widen the opening for cervical examination and sample collection. Question number 49. Which instrument is used to secure surgical drapes? Your options are towel clip, forceps, retractor, or clamp. The correct answer is A, that is towel clip. Towel clips are used to secure drapes to the patient's or surgical table, ensuring sterility during procedure. What is used to close deep surgical incisions? Your options are hemostat, surgical stapler, scalpel, or retractor. The correct answer is B, that is surgical stapler. A surgical stapler is used to quickly close deep wounds or incisions during surgery. Which instrument is used to assess knee reflexes? Your options are reflex hammer, tuning fork, otoscope, or sigmoid-manometer. The correct answer is A, that is reflex hammer. A reflex hammer is used to test deep tendon reflexes such as the knee jerk reflex to evaluate the nervous system. So friends, it's the time to comment your score. So comment below your score that you done correctly. And if the video was helpful, then please do like, subscribe and share this video to everyone who are preparing for upcoming exams. And do support us by liking and subscribing and sharing our channel, our videos. So thank you so much for watching and wish you good luck for your upcoming exams.